I am Dr. Mraihi Fathi. I am a gynecologist and specialized in fetal medicine in the D department of the Maternal Center of Tunis, Tunisian Manar University from Tunisia. I am very, very happy to be with you in this international webinar in cardiology and cardiovascular research. I'm pleased to present two case reports of cantrell pentalogy, which is a rare condition for which antenatal diagnosis is accessible in the first trimester of pregnancy. I have no potential conflict of interest. Pentalogy, the cantrell pentalogy is a rare congenital anomaly that affects the thoraco-abdominal wall, heart, diaphragm, pericardium, and lower sternum. This is a rare condition that has been reported.
Dr. Mraihi,
yes.
Sorry to disturb.
Yes.
Can you please enable the slideshow so that we can see your slides clearly?
Yes. It's okay?
You can see the top button on your PowerPoint presentation. There is a button called slideshow. The left side. Left side.
No, I haven't.
The top, on the top, you can see your title, right? Antenatal diagnosis on the left side.
Here?
You can see a slideshow button. Can you able to? It's okay. You can proceed with this itself, doctor. No problem.
Okay. It is a rare condition that has been reported in less than 115 cases worldwide. Cantrell pentalogy is a rare congenital anomaly that affects the thoracoabdominal wall, heart, diaphragm, pericardium, and lower sternum. The definition of cantrell pentalogy, it is a group of birth defect that involves the chest and abdomen. Cantrell pentalogy affects multiple vital organs, including the heart, chest wall, abdominal wall, and diaphragm. The condition is characterized by 5 primary features. The defect in the diaphragm, abdominal wall defect, sternal defect, pericardial defect, and cardiac abnormality. The original hypothesis attributed to this syndrome is an arrest in the development of lateral mesoderm between 14 and 18 days of embryologic period, since no solitary genetic defect has been associated with it. The prevalence and epidemiology of this condition. Cantrell pentalogy is a rare condition with an estimated incidence 5.5 per million live births. Antenatal diagnosis has become more common in recent years due to the advance in medical imaging technology. Sign and symptom of this condition, the cantrell pentalogy: chest wall defect. There is sternal cleft and ectopicarditis. Protrusion of the heart outside the chest may be present. Abdominal wall defect above the umbilicus. The anterior abdominal wall is absent, and the pericardial sac and bowel protrude through the opening. There is other defect associated malformation may be include craniofacial defect, genitourinary malformation, and limb deficiency. Antenatal diagnosis ultrasound examination can be diagnosed during routine prenatal ultrasound examination. We can also fetal echocardiography can detect cardiac anomaly as early as the first trimester. An MRI scan may provide additional information about the extent of the malformation and help with planning, delivery, and postnatal care. We report two cases of cantrell pentalogy to provide a comprehensive overview of the clinical presentation, diagnosis, evaluation, management, and outcome of these two cases. Case 1 presentation at 12 weeks pregnant, 29 years old lady who was gravida 1 O visited our department for a standard prenatal scan. The patient had no significant medical history and there were no congenital defect in the patient family. A single live intrauterine gestation with a gestational age 12 weeks and 2 days was visible on the prenatal ultrasound. Through a defect of the lower sternum, the fetal heart could be seen outside the chest in combination with an anterior diaphragmatic and ventral abdominal wall defect, which are suggestive of a thoraco-abdominal type of ectopia cordis. There is a heart, fetal heart outside the chest with an anterior diaphragm and ventral abdominal wall defect, which are suggestive of thoraco-abdominal type of ectopia cordis. You can see here the image, the ultrasound, and the heart is outside of the chest. There is the chest, and the heart is outside of the chest. And after termination of the pregnancy, you see that the confirmation of the pathology, and you see the heart is outside of the chest. The second case presentation is a 32 years old woman who was 15 weeks pregnant. She was referred to our department in this situation. She was 4 months pregnant and had no noteworthy medical history. The patient prenatal ultrasound identified numerous fetal defects, including diaphragmatic hernia, a big omphalocele, a midline abdominal wall defect, and the ventral wall defect. The heart and the portion of the liver were outside the chest cavity due to the fetus thoraco-abdominal ectopia cordis. The patient did not disclose any major medical history or pregnancy-related exposure to teratogenic substance. These results strongly support the pentalogy of cantrell. And here you can see the ultrasound of the chest and the heart and the portion of the liver, which are outside the chest. There is a chest and heart and a portion of the liver are outside the chest and abdominal throughout the abdominal wall defect. There is here also the portion of the liver which is outside, and the fetal examination after termination of pregnancy confirm the condition which you see here, the wall abdominal thoraco-abdominal wall defect and heart and the portion of the liver and which are outside. Both cases were presented with midline abdominal wall defect. on fallow cells and cardiac abnormality, which are characterized features of contral pentalogy. They underwent imaging which revealed the extent of the abnormalities and helped in the diagnosis. For the dog, expect mother and their family require emotional support to deal with the diagnosis of contral pentalogy and the challenges that lay ahead. We can also, antenatal counseling is also necessary and should be provided to determine the best mode of delivery and plan the postnatal care, which will be multidisciplinary. Option of treatment, uh, there is surgical repair of the malformation can improve the quality of life and increase the survival rate of patients with contral pathology. Cardiovascular support is crucial in the immediate post-operative period as patients with contral pathology often develop a cardiac failure. And long-term management may involve multidisciplinary care with specialists from different fields, including cardiology, surgery, gastroenterology, and rehabilitation medicine. As a conclusion, prenatal diagnosis, early antenatal diagnosis of contral pathology is essential for appropriate management. Patients require interdisciplinary long-term care to manage the complex nature of the malformation. Surgical repair can improve outcomes for patients with contral pathology, but is often complex and challenging. The rarity and the complexity of contral pathology highlight the importance of increased awareness among healthcare providers, including obstetrician, neonatologists, and pediatric surgeons, to facilitate early recognition, to prompt referral to specialized center, and to coordinate multidisciplinary management. Thank you very much.